Good evening. I'm calling.
Recording in progress.
Good evening. I'm calling to order the Yarmouth Board of Health meeting for January 5th, 2026, our first meeting of the new year. This is a in-person meeting, but it is also available by YouTube on the town channel as well as by Zoom. And the instructions for accessing those are on the town website. I'd like to call the attendance first. I'm Mary Craig, Vice Chair. I'm sitting in for Hillard Bosky, the Chair, this evening. Eric?
Present.
Larry?
Present.
Thank you. So we do have a quorum. I'm going to move on to public comment. This section is for people who wish to comment on something that is not on the agenda tonight. We will not be responding to the comments, but you're welcome to make them.
I do have something, Mary. The original Zoom link from 2025 has expired. The new Zoom link is on our town website and on our health website. So for the audience looking in there, they're trying to get in and it says expired, that we do have a new Zoom link. So.
And is that on the agenda that was?
No, we just got it this afternoon. So, but it is already updated on our website.
Okay.
So.
And it will be on the agenda.
Moving forward, yes, it will be.
Thank you. Any other comments for issues that are not on our agenda for this evening?
Looks like we have one hand up.
Is there a hand up out there?
Yeah.
Yeah, I apologize. It's on the agenda, so I guess I can wait till then to comment, or do I comment now about banning kratom?
Yes, I'd like you to wait until it's on the agenda, please.
Okay, very good. I apologize for that.
That's no problem. Thank you.
Yep.
And now we will move on to item number 4, which is the Kratom discussion. This is probably the third time that we have discussed it so far. Pretty much we agreed last time at the last meeting that we would look at regulation of this substance. I'm going to ask Larry in a few minutes to kind of do a summary of what our discussion was. But in the meantime, I just want to mention that I had asked we pursue the option of putting it into an already existing policy that we had, I thought, adopted in 2017 on cannabinoids and synthetic cannabinoids. When Barry researched that, he found that that policy had never been sent forward through the proper channels. So it was in effect, not in effect. So that's why that policy is included in your packet for this evening. It will give us the opportunity to review it and to get it started on the official process, so it will indeed become a Board of Health regulation. So, Larry, would you like to give us a little bit of a summary?
Give a little summary of the information that I found that was creditable, because I was totally unfamiliar with the substance until I did a little bit of research, and then we discussed it here. So I'll just go over what I found. Is kratom is a psychoactive substance derived from the leaves of Matragna species tree, a tropical evergreen in the coffee family, native to Southeast Asia. It is unique because it produces both a stimulant and opioid-like effect depending on the dosage. At low doses, kratom acts as a stimulant, leading to an increased energy, alertness, and talkativeness. At high doses, it has an opioid-like sedative effect such as pain relief, relaxation, and euphoria. The primary active chemical compounds, alkaloids, in kratom are mitragynine and 7-hydroxymitragynine, which primarily interact with brain's opioid receptors. Legal status: it's not currently a controlled substance, though the DEA has listed it as a drug of concern, and its legal status varies by state and locality. The FDA has issued warnings against its use due to potential health risks, including addiction, liver toxicity, and seizures. The U.S. Food and Drug Administration has warned people not to use kratom because of possible harm it may cause. Known side effects include weight loss, dry mouth, nausea, vomiting, constipation, liver damage, muscle pain, high blood pressure. Kratom also affects the mind and nervous system, causes dizziness, drowsiness, hallucinations, delusions, depression, trouble breathing, confusion, tremors, and seizures. That would all be dose-related, incidentally. Poison Control Center in the U.S. received more than 3,400 reports about use of kratom from 2014 to 2019. These include reports or include death. Nearly all reports of death, though, were also involved with other drugs or substances that may have been harmful. Kratom also affects babies during pregnancy, in that it can induce opioid dependency in a newborn, same as opioid would in pregnant mothers. Kratom products, because they are currently not controlled by any established quality control organization, have been found to contain heavy metals such as lead and harmful germs such as salmonella. The FDA has linked more than 35 deaths to salmonella-tainted kratom. So that was our main concern, I think, when we discussed it, was the fact that it's really not controlled, or the quality control is non-existent currently. And our big concern was whatever's out there over the counter is produced totally, unregulated. And that was, considering the potential side effects, that was at least, I think, the concern of our board.
Right.
So I do have
That sound right?
I do have a drug fact sheet from the DEA, but it's readily available if you Google it. It's called a drug fact sheet, Kratom, and it's published by the Department of Justice Drug Enforcement Administration, and you could Google that.
And is there a date on that?
The date on this, let's see. No, I don't have a date. Well, I've got April 20th. Yes, it was April 20th,
2020?
2020. April 2020, yes.
This.
So that was the other issue. All this data that I could find was not current, and it's much more prevalent. The use of it's much more prevalent since. So the data I found was dated. So it's very possible that these statistics could be even more concerning if they were brought up to date.
And there's been no clinically controlled studies,
There hasn't been.
and
No.
probably would not be readily done because it is a natural product if you're talking about just the leaf. So it's not something that can be licensed or
Yeah, it's
or
not
copyrighted.
proprietary.
Yeah,
Yeah, so there's no
there's no
company that
financial-
could patent a product.
right.
So that's why it's unlikely that there'll ever really be a lot of research done unless it's done independently
Right.
by a university or the government.
Or if the association, the Kratom Association that's out there, if they can privately fund it.
Yeah, if we could depend on that source of information, yes.
Right, right. Eric, do you want to add anything to that? We have also in our packet a proposed regulation that Hillard had put together. Did you all have a chance to look at that? Any comments on that?
I read through that, and I propose that we accept that. if it's
Well,
with it.
We're not doing any votes tonight.
we're-
Tonight's just a
yeah,
discussion,
I'm not
yeah.
entertaining a motion for that right
Okay.
now. I would like to add a couple of things. I'd like to add the definition for consumption on the first page, because it does talk about it under the unregulated novel intoxicating products, but it doesn't talk about it in terms of the entire regulation. So I just put in that definition. And I just had a couple of grammatical comments, so I can give those later. Eric, did you have anything that
I really didn't know. I mean, I thought it looked, Clean.
Isn't this the one we edited in the last meeting? Did we edit this?
He based it on at least one of the other towns.
From two towns. He combined two towns in
Warren
it, then
and-
his knowledge and expertise
Right.
combines as a combination of everything.
So that's why it sounds familiar.
Yeah.
Yeah. Okay, well, if there's no other comments, I know that there are people out in the audience, and I'm guessing they might be here to talk about Kratom or comment on it. And if you'd like to come up and identify yourself, your name and who you're representing,
And where you're from.
and where you're from, right?
I'm Vishal Shukla. I'm owning the Yarmouthport Village store as well as the Station Avenue Convenience store.
Can you speak a little bit closer?
Yep. So, the study-wise, I think when I talk to the companies who does sell us the Kratom's bags and the tablets and everything, so they did say like if I scan back of the barcode, it will show the lab report and everything. And if you guys, want to see it, I will do that tomorrow and bring everything up and send it to Barry and see what you guys feel about that. They do have all the lab reports from the labs and say what's going on with the product itself. So I will happy to do that, and will provide every information that I can.
So you're talking about it tells you what the ingredients are? in
What the
pack-
ingredients are and what the whole panel, yes, the lab panel. They do have the whole lab panel, and what they made out of, or what they do, and all the, obviously that effects, side effects and everything in that pamphlet also. So I will happy to provide those, and we go from there, I think.
What is the name of the company that supplies it?
It's called Whole Herb. They have a,
Whole Earth?
no, the Whole Herb.
Herb.
Whole Herb, and they have a remarkable. That's the second one, but they have the information on website also. But I will provide you individual bags, like all the different kinds of kratom, what they made out of it, lab results, and what the side effect and effects.
Do they have just one product, one type of bag?
No, they have a different product, so I can give you all the data that it can be available.
And is it a product that's sold pretty much widely, or is it? not
Yes,
a
yeah.
big
No,
seller?
it's sell widely, and it's probably the whole United States probably, yes.
Now, is this a single company and there are other companies that produce the same product, or does this company control all the products? that
No,
are-
they have a different company, and they all have those lab tests and everything. Once you scan the barcode in the back, that's like when you go in any venue and you scan the barcode, and it'll give you the information. Same exact thing. We didn't know that until we called them up and say, "Listen, we do need some information so we can at least present to the board and find out what's going on." And he says, "Yeah, so you can just scan the barcode and the information is right there, for sure."
Well, thank you. That is interesting. Again, though, probably because there have been no clinical studies, there won't be any information on studies of the particular ingredients, especially in combination. But it's interesting to know that they're listing that, and I would like to see that.
Yes, absolutely.
Thank you.
Yeah, we'll provide that. I'll
Okay.
get
Do you
you.
have my email address and everything?
Yeah, I do.
Perfect, thank you.
I think this is very similar to different dog foods. They all list their ingredients, and the difference is that with Kratom, there's no official organization that scrutinizes what's on that label. And that you have to accept the statement from the company of what's there. And that's the big issue with it.
Are there any other people that would like to comment, or,
Looks like we have a couple hands up.
okay? We'll
As long
take
as they're
some
from
online.
Yarmouth, that'd be great. So we could take the first one, we could take
Hi, my name's Allison Smith. I'm the Government Relations Director for the Global Kratom Coalition. I just want to flag something really quick. There are studies regarding the safety of kratom. The FDA did a study last year. It's called a single ascending dose, and I'm more than happy to share that with you. But they found with participants of adult age who took from 4 to 8 or 12 grams of natural kratom product that there were no adverse effects. Additionally, there's another adverse study that I'm more than happy to share with you guys to demonstrate the safety and efficacy of natural kratom products. I just want to flag that really quick.
Allison, thank you. Would you give the name of your organization again, please?
Yes, it's the Global Kratom Coalition. And we also have lists of products that are considered natural products versus the synthetic concentrated products that are dangerous and a public health risk. And I would be happy to share that information with you as well.
Thank you.
Couple more hands up.
Other hand?
So I'm here. I don't know.
Oh, we'll let John speak because.
Okay, great. I didn't know if you were calling on us or, yeah, go ahead, John.
Thank you, Laura. I'm John Schenholz. I am the Advocacy Side Director for American Veterans for Kratom Safe. I'm a United States Marine Corps veteran. And there are, the American Kratom Association, they do have an organization of vendors who all their products meet rigorous standards to meet all the safety factors for kratom, but natural kratom leaf products, yes, there's an alkaloid that does attach to an opioid receptor, a very small amount, but it doesn't have any alkaloids that attach to the receptors that suppress your respiratory system. So there's over 600 scientific studies done, over 200 peer-reviewed. Johns Hopkins has been doing clinical trials for the last 2 years. And Nora Volkow, the director of NIDA, she's spent over $100 million and spent 15 years doing these studies on kratom. And kratom, it's true, it's a plant. And nobody wants to invest the billions to get an FDA medication because you can't patent a plant. But in the marketplace, every day in America, somebody actually dies from one of those caffeine drinks. There's over like 300 deaths a year from those little shots you buy at the mini mart, but they're not trying to ban coffee. What they're really trying to do is restrict the bad products. And a good Kratom Consumer Protection Act that you can enact, if you get rid of all the chemical problems, all the synthesized products, the problems basically go away. And it's got over 200 years of documented use going back to the 1800s, where they actually used kratom to get people off of opiates. So it's a great product if you can't get access to any other medical help or attention it helps alleviate opiate detoxes. So there's many uses. There's estimated 10 to 20 million consumers in America who safely consume kratom. There is a small addiction profile that's been proven. However, those are very, they're not, some of them are pretty bad cases, but most of them aren't that bad. There have been some deaths associated with kratom, but typically there's other products involved. So most of the problems that you hear is really what product were they using, where did they get it? But to try to ban kratom, it's like you put so many people at risk that rely on it for their quality of life, and it has been proven to save thousands of addicts who pivoted from a one pill kills to a natural product. So, I just feel like if you dig a little deeper and actually look into the science behind it and really see what's available and out there, your opinion and your thoughts, I'm certain would shift to a more practical regulation versus a ban. And you do have access to great information from the American Kratom Association, the American Veterans for Kratom Safe, the Plant Life people. So, and I do appreciate your time, and I don't want to take up a lot of time, but if you have questions, I'll be happy to answer them. But more important, I can provide you with so much information if you'd like to review it. Thank you.
Thank you, John. I'm
John.
interested in the 600 peer-reviewed studies that you cited. Do you have
200
any?
peer reviewed. There's over 200
200?
peer reviewed of over 600 known studies, and there might be closer to 800 scientific studies.
And
University of Florida, John Hopkins, they've been University of Florida been working on kratom for 20 years. They have, if you Google University of Florida and kratom, you'll see hundreds of, I would say hundreds of studies pop up on their website.
so University of Florida, Johns Hopkins, and who else is?
Those are the two big ones, and Laura might know of some other universities. And the leading scientists from there, they all agree that natural kratom products, that they are safe for the marketplace. But they also agree it's the chemicals, the adulterated products, the synthesized products, the 708 products. They're very, very dangerous. And I hope you ban those from your community. But please don't confuse it with natural kratom products. That's the big problem we're having, is the demonization of kratom and its consumers. And it's actually the chemical products that it's just like what they did to cannabis. They take natural CBD and then they do the Delta products. The same companies that did that, they're doing it to the kratom industry. And it's horrifying to know what's taking place out there.
Thank you, John.
Thank you.
Okay, can I speak now?
Yes.
Great, yeah. So I'm Laura Romney. I'm with the International Plant and Herbal Alliance. I work really closely with the American Kratom Association, and I really appreciate you letting me talk today. I highly suggest that you look at the email that I sent you today, and there's one I also sent you about a month ago that gives you a lot more information. Watch the little video specifically because it ties into what I'm going to say next. So I know you've heard a little bit about, I know you're concerned about, what the FDA and things are saying about kratom, but it's very, very important to understand that on July 28th, there was a press conference that the FDA and Health and Human Services held. And at that press conference, they announced that they are wanting the DEA to schedule 7-OH products as Schedule 1. And they wanted them to start that process. But what was very clear, and again, that little video that's in that clip that you'll see on your email shows numerous times where, Commissioner McCary said we are not after whole leaf natural kratom. We are only after the synthetics. That's the only thing we want banned because there is, proven health and wellness benefits to the kratom product. A lot of the studies that you quoted, things about like seizures and hallucinations and all that, if you actually dig into the actual studies that people are referencing, it's literally like a single case study. Like someone will have walked in that's actually a bipolar or has other hallucination type schizophrenia, and they'll say, well, this person is a kratom consumer, and they tie it together. So again, it's a little bit deceptive as far as, some of those, you can't necessarily say without looking at every one of those studies, to know that there is health benefits and it's not as scary as it sounds. And again, there's a book out there. In fact, I'll just give you the author. It's a great book. It's actually for sale on Amazon. It's called Kratom: History, Science, and Therapeutic Potential. It's by Dr. Jack Henningfield, Heningfield, and he has an entire book that's set aside with all of those kratom, not all of them, but a huge number of the kratom peer-reviewed studies, so that you can see that there is a lot of information. One last thing is I wanted to say is that I appreciate the gentleman who spoke about the product that's in his store. I am aware of those two companies, and it's correct. There are great companies out there that have reputable laboratory results. These are outside labs. These are not, just they went down to the store and did a little test. These are, outside lab, third-party labs that make sure that there's no salmonella, heavy metals, and what they're saying is in the product is in the product. So there is a way to do it. Again, I highly suggest that you put an age gate in so that 21 and up is only people that are allowed access, because it's an adult product anyway. You also want to make sure that there are products like he referenced that have laboratory findings and that have proper labeling And then, of course, that the restrictions on the amount of 7-OH allowed in the product, which will eliminate all of those synthetic 7-OH products from the shelves. And so there's an absolute way to do this the correct way, but it allows people like myself who have relied on this product for over 9 years for my chronic health condition. If I didn't have it, I cannot even tell you how miserable my life would be. And again, I'll leave you by saying, just look at those screenshots that I sent you today of just the last couple of weeks of some of the people throughout the country saying how difficult it is to get any form of pain medication these days. And so it's just so important that alternatives like Kratom are available. Thank you so much, and I'm here to answer any questions.
Thank you, Maura. I'm interested, this is a national organization that you're in. It says National Plant Alliance, correct?
No, it's International Plant and Herbal Alliance.
Okay, International Plant, right. I understand that there are some other states that have banned Kratom.
Yes, yeah, and I can explain those in very easily. So back in 2016, the FDA actually went after whole plant Kratom. They said, we think that this product needs to be banned, and they were very nervous about it. So they said, well, we want to do the same thing. It's called an 8-factor analysis. They go in and they study it, and they have to meet 8 qualifications. And if they meet those qualifications, they asked it to be scheduled as a Schedule 1. Well, they did. They actually did that 8-factor analysis, and it failed. And they said, no, it does not qualify to be scheduled. There are health potential benefits, and it just didn't meet the qualifications. What had happened is several of the states back then, they just jumped on the bandwagon thinking that this was going to be scheduled, and they went ahead and initiated a ban. And so we've been working closely to try to re-educate some of these states. And in fact, Rhode Island, which is very close to you, just reversed that ban. And as of April 1st, they will actually allow whole plant natural Kratom, not 7-OH and synthetics, but just whole leaf Kratom will be legal in Rhode Island. So that's been the majority of the cases for the state bans. It's just taking some time to re-educate and help them understand, especially now with 7-OH in the mix.
Thank you.
You're welcome. Oh, and by the way, there are 20 states in the nation that have passed the Kratom Consumer Protection Act, which basically mirrors all of those, those factors like the age gate and the 7-OH content. All of that mirrors that, and you could pass a similar ordinance in your city that would mirror those states that have done it correctly.
And what's a state closest to us?
That would be, well, again, you can look at Rhode Island. That's a perfect example. You can see what their latest one, because they just barely passed that. And again, it will go into effect on April 1. So I highly suggest, and again, I can send you some examples of that. I'm from Utah, and we are one of the states that have a KCPA, but there are several states around you that do. But the most current one that just barely passed is that Rhode Island. So it would be a really good one for you to look at.
Thank you.
Yeah, no problem.
Is there someone else who would like to speak? I think I'll take a couple more, and then we need to move on.
Hi, can you guys hear me?
Yes.
Yes.
Sorry, I had my volume down. No, I just wanted to let y'all know, I testified at the last hearing that you guys had, and just wanted to let y'all know that I was here in attendance. And I want to kind of piggyback off of what Laura and John have said. I survived, well, not really what they said, but I survived the overprescribing opioid epidemic. I've been consuming Kratom this would be my 7th year. I'm a recovered addict now because of it. I found whole leaf Kratom by accident. I was not looking for recovery when I found it. I was just looking for something to help my withdrawals that I was going through at the time. And little did I know, here I am today, I can proudly say that I'm a recovered addict. So, and I don't take it every day. It's not something that I crave. I take 1 to 4 days off every week. I'm not on any Kratom right now. You know, my pain is a little bit elevated, you know, my degenerative disc disease that I have in my back, but it's not something that I crave. Now, the issue that y'all need to tackle, though, is the synthetic 7-OH, because if you're having problems in your community, it's because of those synthetic products, not the whole leaf kratom powder. You have to know how to differentiate it. And I'll be here to answer any questions if you have any.
Thank you. And would you give your name and where you're from again?
My name is Misty Brown, and I live in Colorado.
Thank you, Mitzi.
You're
Yep.
very welcome.
Well, a question I had for Mitzi, is that something you would get at the convenience store, or do you have a source to purchase what you're using?
When I found kratom, I walked into the smoke shop, and it was sitting behind the counter in a glass case, and it was locked up, and I had to show my ID to get it. So that's how my journey started. Right now, I do order online, you know, and I go through the companies that follow the good manufacturing practices, which is what they mirror the FDA, you know, regulated goods, you know, general GMP compliance. So that's where I get mine from. And the gentleman that spoke in the audience, talking about whole herbs and remarkable herbs, they follow those same practices as well.
Thank you. One more?
One more, please.
Hello,
Hello?
can you hear me?
Yes,
we
ma'am.
can.
All right. My name is Dr. Heidi Sikora. I'm a retired healthcare executive and nurse practitioner, and I currently serve as Chief Scientific Officer for the International Plant and Herbal Alliance. I work closely with Laura Romney, and I know that she sent a detailed email with a lot of education, unfortunately, you know, this information that was shared tonight isn't actually evidence-based. I mean, I heard that kratom causes seizures and all kinds of other issues. And I just want to say, I think it's important to really remember that correlation does not mean causation. And there truly has not been a demonstrated cause of death for kratom products, for natural kratom products. And I think that's extremely important to remember. Even the FDA says that deaths by kratom alone are very rare. And and often it's polysubstance or underlying conditions. I think that's very important. The other thing I wanted to say is I heard, you know, the confusion about kratom being an opioid. It really is not a classical opioid. It's a partial mu opioid agonist, just like coffee, cheese. And so the natural product has an excellent balance and multiple alkaloids that balance each other, the primary being the mitragynine. 7-OH, 7-hydroxymitragynine, actually is not in the natural leaf. It only is produced as it metabolizes through the liver and in the natural powder concentration and natural extract concentration in very low levels. So those products are actually very safe. So why should you regulate instead of ban all kratom products? Most important reason that kratom, natural kratom, does not cause people to stop breathing. Other products do, obviously. Opioids, that's the reason that people stop breathing when they take an opioid. I mean, that's the reason they die, is because they stop breathing when they take an opioid. So those people that are using kratom instead of opioids, now if you ban kratom, you really put them at risk for death. And so I think that's very important. And I know that your time is short, so I think that Laura and John and other people have shared important things. And if you have any questions, I'm here to answer them.
Thank you very much, Shannon.
Thank you.
That was Heidi Sikora,
sorry.
Dr. Sikora.
Dr. Sikora. Sorry, Heidi.
That's okay.
Can I
It's
make a
okay.
comment on that?
Yes.
We didn't say that when I read it. The mitragynine works on opioid receptors. I didn't say it was an opioid. And the information that I got came from the FDA and the DEA websites directly. That's they were evidence-based information. They were extreme, but that's where the information came from.
Yeah, I understand.
And the other,
Thank
the
you.
other, the other issue is that unfortunately, what we're concerned about is these products being sold anywhere. And they're basically unregulated. And that's the concern for us here in the town of Yarmouth, at the Board of Health, is
I
that
would
these.
say, I would say that you can do a local Kratom Consumer Protection Ordinance, and there you go. Now you have your regulation that will keep people safe. And that's been done all over the country.
So
There's been a
how
lot
would
of
that
local-
work?
Well, I do believe that, I think Laura already sent you a copy of an example of that, but basically what you do is you just make sure that it follows the guidelines of the Kratom Consumer Protection Act, which means that the products are lab tested, that the alkaloids are in line with the natural plant, that there's no more than, 1 to 2% of 7-OH in any product, then you know it's a natural product. Age gating, 21 and above. Labeling. So the things that Remarkable Herbs and I forgot the other company, but the things that many companies are already doing these standards, and they are preparing it according to good manufacturing practices. So they're following all the FDA guidelines under, for dietary supplements. They're following all those guidelines, and they're very safe products. And so you could even have them register those products and say, okay, these are the products that, so a shop could come to you and say, these are the products we'd like to sell. And, you limit the number of SKUs that they have, limit the number of licenses in your community so that you don't have you don't have it on every corner or whatever. And then you can even charge a licensing fee so that can help fund the enforcement that you need.
Okay, thank you.
Mary, we
And
did
more
get
than happy to help.
we did get a lot of emails late this afternoon, like today and later this afternoon, that Riley has put together in the file that we have sent you before, but we will send you an updated one also with all these emails and PowerPoints that they're talking about today. So we just didn't have time to get them to you promptly, so they came
Well,
later this afternoon.
we are still discussing, so that would be helpful, and I'd certainly like to move the discussion to continue at the next meeting,
Sounds good.
and after we have the additional information that some of these speakers have talked about. I'd like to go on now to the next item, which is the nicotine-free generation discussion. Again, this is a discussion that I think this is the third time it's come to the board to discuss. And I don't have anything new except for that wonderful Excel spreadsheet that Riley put together for us, like she did for Kratom, with all of the, mostly emails that we've gotten, some business owner letters. And Barry, I know you've had some comments from people. Do you want to kind of give us some background as to what's been going on with this?
Yeah, just again, kind of like the Kratom, we're getting lots of emails and concerns from the public about thinking that we're banning all tobacco products. I got an email today, someone said, please do not ban outdoor smoking. This nicotine-free generation is not, that's not what we're about. We're not trying to ban smoking from adults. It's to prevent the youth of our future from starting to smoke and giving them the ability to be able to start to buy nicotine products. It's to prevent the future generations. Not anybody currently over 21 would not be affected by this.
Does that seem to be the main concern people have who are sending you?
A lot of people think that we're banning all nicotine products in town, which we are 100% not doing. So, we're discussing to ban all nicotine products in town, which we would not
Right.
do. So,
Right. And this nicotine-free is something that has been adopted by other, 19 or more
19
towns?
plus communities, and there's some growing in the state, yes.
Massachusetts, right. And it started with Brookline, and they were sued, and the Massachusetts Supreme Court said that this was a valid
Upheld their decision, yes.
decision by a health board to protect the public health.
Yep.
Any comments from the board in terms of the additional information we've been sent about it, or the original information?
Well, I'll just reiterate what I said the last time about, there are two main concerns that folks have about this nicotine-free generation ban, or the banning, or the proposed program that we came up with. And number one was the concern for the economic impact of these businesses. The other concern is that people ought to be able to choose, make free choices as to what they'd like to do. And as I said at our last meeting, I'm an old guy, and I've never met anybody in my age bracket that's ever told me that they wish they'd never started smoking. So
Hasn't told you that.
that hasn't told me that they wish they hadn't started smoking. So to me, to answer the economic impact, it's a tremendous economic impact to the society in the health issues that smoking causes and the strain it puts on our healthcare system. And also, it's been shown that if you're a chronic smoker, you stand a 50% chance of dying in your lifetime from complications from smoking. So I don't really think, looking at it from that perspective, I don't really think that there's really any impact on anybody's bottom line in a business that would warrant us continuing to carry on the way we're carrying on. So I think we need to make an adjustment in that, and that my sense is that the impact economically that makes on a business that'll be absorbed by other expansions in business. The other point that I'd like to make is that as far as the free choice issue, it's not the general public's free choice to have to support the healthcare costs that are imposed by the consequence of these chronic smokers, that the healthcare costs that they place on our healthcare system. So I think based on that information that we got at the meeting 2 meetings ago by that group, that their proposal is a compelling one. And I would support us continuing with that proposal.
Eric, do you have any comments? I think, yeah, what's happening right now, if we continue, is we're killing off customers who are
Well,
smokers.
that's the point.
But-
And plus, nobody wants to, who wants to have their business based on the backs of, of people's health? I think that it's short-sighted to do that.
One of the things that I think helps with that particular concern, because it's a business concern, and we're
Right.
public health, but we live in a business community too, is that it's a gradual kind of thing.
Right.
Just a person drops off, or a cohort drops off each year, but it's not a complete ban. So you've still got people out there smoking, and as long as they don't get cancer, or get hit by a car or whatever, they're still a live smoker, and they're going to be smoking because it is addictive, and people try to stop smoking. And so I think that's it certainly means that eventually, at least in this town, there might not be any people buying cigarettes or smoking products, but
That'll
will
be
be
quite a ways
years from
in the
now.
future.
Yes, it will be many years from now. And we'll have a healthier community for it, certainly. And like you said, maybe some new products will come up that will get people into the stores and they'll be healthier for it.
And it still remains probably the third or fourth question you're asked whenever you go to any healthcare facility, do you smoke?
Oh,
There's a reason for that.
absolutely. And I was surprised to find out that you cannot become a police person or a fireman person if you are a smoker, or in the military.
Didn't know
You're
that.
not accepted.
Yeah,
It's
that-
not accepted.
That's something
So
fairly new,
that,
fairly
that
recent.
shows you what, what certainly the government thinks about smoking. I'm guessing there might be some people out in the audience that would like to speak to this one. And if so, you're going to do again? Okay, come on up. Did a good job first time.
Yeah, this is Vishal Shukla. I just mentioned it before, owner of the Station Avenue Convenience Store as well as the Yarmouth Port
Speak a little bit closer.
right here. That's good? Okay. So when we say economic impact on the business, a convenience store, we do probably 60 to 80%, close to 60% to 80% business selling cigarettes and stuff like that. Candies, sodas, and stuff like that should be like only 20% or 25% to 40%. So taking the portion out of the business, it will impact in the future, definitely, not right now. So after 21 years, what's the other options we gonna have that you can think it will support that gap?
You are saying that 60% of your sales are,
Convenience store, strictly, 60% sell of the nicotine product. So if that's 60% out of our business, and I would like to mention we are like a tourist towns.
I'm sorry?
We are tourist towns, and the people who adopt
Oh,
those regulations, they are in a heavy population town. We are, I don't know how much percentage we have visitors coming every year to the Yarmouth, maybe 20% or maybe 30%, I don't know. So that would be the impact also. Like they will say, it's like, one town does it and second town doesn't. So we obviously gonna lose that business also, because the other town did adopt all the regulations, like a Brookline. You can imagine how many people are there. So they can grab business somewhere else, or the neighborhood towns get those business too. So that's my question, like what we can do to fix that 60% gap in the future. Is something else would you think it would comes up and say, okay, you can fill that gap?
I can't see the future and know what might come up that would become a product that you
Right.
could, would account for 60% of your sales. But we talked about that when we had public meetings and we did our regulation about 21 years. I
Yes.
know Hillard talked about looking at your business plans and looking ahead, because back then, this is something that we saw, and it wasn't just us. We've tried to be a leader on the Cape anyway, but now it's statewide, and we could see this momentum coming because this is public health is our business.
Absolutely,
So
yeah.
we know that all of these new studies, actual studies, showing the effect of smoking on the human body,
Right.
and the whole society, as Larry has talked about, was going to be becoming more and more of an issue
Right.
that people were going to address. So I guess that's I think one of the things I would say is that I understand. I had no idea it was 60%, and that's kind of scary. But yeah, I think you need to look at business plans and what can you sell that might take up that slack. But like I said, this is not going to happen all at once. So you're already not selling to people who aren't 21. So that part of your business has already been taken away. And then gradually, year by year, you'll be selling to fewer people. And there are other towns on the Cape that are looking at this, right, Barry?
Yes, ma'am, there are.
Yeah, so,
I have a question. You said 60%. Is that 60% of number of sales or 60% of your profits come from?
60% of number of sale.
So number of sales. So it's not, okay. So it's
not
not,
your revenue.
not 60% of your revenue. 60%
Well,
of the number
sell
of sales.
sell is when the property comes from those sales. So yes, 60% of the revenue too.
So what I could add to that is, if you look at the numbers, 60% of your sales, but we're only talking about 21-year-old people per year. Now, you look at the age of your population that buys your cigarettes, and they're going from 21 up to 80 years old. So it's going to be spread out over that whole age group. So this is only going to be a small percentage of that 60% each year. And then it'll
gonna go
give you
down,
a
yes.
chance to adjust to that loss of revenue by trying to find another source of revenue. But at the same time, that, in a sense, shouldn't be our priority, because our priority, as Mary said, is the health of our community. And if we can't support a business that doesn't support the health of our community. I mean, that's really important for us to take that into consideration.
No, health is the first thing. That's, and we always, for it. Like when we did the 21-year limit, we did support that.
Yes.
We did the flavor ban. I think we are the first one in the Cape who did the flavor ban, if I'm not mistaken.
Yes.
And so we did support every single time for that. But this is like little unnecessary, if I may. But if you think it is a good thing to do it, it's fine. And the one question is like, is that the marijuana is the same effect as nicotine, or is it different?
Different.
No,
Yeah, it's different.
totally different.
Comparing apples to oranges on this one.
Right.
So take the oranges and give us an apple.
What was the question?
So what my question is like, what's the effect from marijuana and what's the difference between the effect for the marijuana and nicotine product?
Well, nicotine products take their toll from a chronic disease over time. They're a chronic irritant to the body, and your body reacts to that, whereas marijuana is not. Marijuana is a transient psychoactive drug that's in and out of the body. At least as I'm aware, it doesn't cause any deleterious long-term effects as chronic use of tobacco would. So they're totally different.
Right. So marijuana is probably better than nicotine. Am I right? If I'm understanding right?
Yeah, I'm not very up on marijuana, so I couldn't. I do know that marijuana, as far as
yeah.
I'm concerned, doesn't cause any long-term health issues if it's used properly.
Right.
But again, if you're smoking marijuana, if you're vaping marijuana, you're still going to get that effect in your body in
That
terms of your
irritant.
lungs, at
Exactly.
least, like you said, the irritant.
Yeah,
So,
that's inflammation. And chronic inflammation is one of the leading causes of chronic disease. It's been proven over and over.
particularly cancer, that smoking is related to one of the major causes of bladder cancer.
Because of chronic inflammation.
Right. I mean, that's scary when it affects every.
So when the Barry says, you comparing apple to oranges. So for example,
Yes, yeah.
apple is nicotine and oranges is marijuana. So take the apple and give us an orange.
Thank you. Anybody else would like to comment? Yes.
Yes.
Hello, my name is Harry Patel. I'm from Bond, Massachusetts. All I want to say is I'm opposed to this. I just don't like this nicotine, like all that things going on right now. Just my friend was talking about it, about marijuana and nicotine, all that stuff. I can start smoking joint right now. It's gonna be a problem too, just so you know. Thank you.
Thank you. Anybody else? Eric, anything you want to add?
I don't think so.
You want to weigh in on marijuana versus nicotine?
No, I'm not gonna touch that one.
He might know more about marijuana than I do.
Oh.
It's very old information. Okay, let's get back to the agenda here and see what we've got.
Mary, we
going.
do have a couple hands up on
Oh,
the,
I'm sorry, online. All right. I'll take a couple of people online.
take two online.
Somebody want to speak up on?
Oh, can you hear me?
Yes.
Yes.
Ken?
Oh, hi. Okay. Hi. Good evening, members of the board. My name is Paula Cody. Sorry I couldn't make it there in person tonight. I have another engagement in a little bit that I need to be at. I am from the town of Bourne, but I work with a few small businesses in the town of Yarmouth. Can you hear me okay?
Yeah, we're getting some,
I'm sorry?
yeah.
Yes, we can hear you.
Oh, okay. I just heard stuff in the background. I'm also a consumer and support local businesses in Yarmouth. I want to respectfully express my concerns regarding the proposal to create a nicotine-free generation by permanently banning the sale of nicotine products to people born after a certain year. While the goal of protecting public health, especially youth health, is important and shared by many in our community, I believe this policy may create more problems than it solves. Laws that single out one generation for permanent restrictions raise concerns about fairness and equal treatment. Two adults of the same age could be treated differently under the law simply because of their birth year, which may undermine trust in local governance. Additionally, this type of ban may be difficult to enforce and could lead to unintended consequences. History has shown that prohibition can encourage black markets, reduce product regulation, which could lead to unregulated products and potentially more dangerous products. At least when you get a pack of cigarettes, it will say, hazard to, unborn fetuses. It's right on the package all over it that it's bad. Something on the black market. These kids could be just buying it and taking someone's word for it that it's gonna be okay for them. Education, prevention, and support have proven to be more effective long-term strategies. Investing in evidence-based education programs, clear age restrictions, and resources to help people avoid or quit nicotine use addresses the same issue without creating permanent legal divisions among adults. In addition, small businesses could lose income and governments may lose tax revenues. I respectfully ask the board to consider alternatives that focus on education, harm reduction, and consistent enforcement of existing laws rather than adopting a policy that may have lasting and unintended impacts on the community. Thank you for your consideration and listening.
Thank you, Paula.
Thank you.
And technically, what's happening here? It sounds as if some people are talking
I'm not for
against
sure.
what's on.
Is she on speaker, you think?
No, I think.
Looks like there's
I'm
several.
very challenged when it comes to these phones.
No, I don't think it's you, because we kept seeing names of other people, and I wasn't sure if maybe they were trying to speak at the same time you were talking and not realizing it or what. But we'll try one more person.
Stephen?
Stephen, are you ready to talk?
I'm ready to talk, and I hope you can hear me. It doesn't seem as if my camera is working,
That's okay.
but Okay.
We can hear you.
I would like to address several issues. One issue is that Professor Kate Silbaugh, who was a sponsor of this prohibition in Brookline, said that for people not paying attention, this ban would be very fast acting. In fact, the goal of this ban is total tobacco and nicotine prohibition to adults 21 and over. And that is the goal. So I don't think it's way in the future, at least not according to the proponents in Brookline. A gentleman on the board said that tobacco and smoking is a great expense borne by the public in terms of medical care. I would like to point out that in the 1970s, when about 40 to 50% of adults smoked, medical care costs was 1/7 in inflation-adjusted dollars of what it is today, even though only 10% of adults now smoking. So in inflation-adjusted dollars, medical costs in the United States have skyrocketed as the number of adults who smoke has dropped. I would like you to consider that, if you would. I would also like to say that immigrants of color own most of the stores that sell nicotine and tobacco products. Now, this ban or prohibition may not close their stores, but it will devalue them and hurt their businesses. Brookline merchants have seen drops in overall sales, not just sales of tobacco and nicotine products, but overall sales, because when people go to convenience stores, they buy several items. And if they can't get their tobacco or nicotine product there, they don't go to the store. So as I say, the stores in Brooklyn have seen overall drops in sales since this proposal was put into effect. Now, if the tobacco companies are trying to lure young people to smoke or to use nicotine products, they are not succeeding. According to the CDC, the teenage smoking rate is at a 25-year low. And according to the FDA, the youth vaping rate is at a 10-year low, and their nicotine pouch use is still very low. So all of the kids who evidently were smoking and vaping, etc., are no longer doing that. And as far as the adult smoking rate, it's at an 80-year low. And according to the CDC, 2 of every 3 adults who ever started smoking have quit. So that means it is not a lifelong habit for most people. I will finish up pretty quickly because I thank you for the time you've allotted me. In Massachusetts, we deem residents 21 and over competent to use intoxicants like marijuana and alcohol. I think adults 21 and over are competent to make up their own decisions regarding tobacco and nicotine products, neither of which impair judgment or compromise driving skills. I ask you not to pass this prohibition, which does not affect you, but limits the autonomy of adults in Massachusetts 21 and over. Thank you.
Thank you.
Thank you, Stephen. Where did you say you were from, please?
I'm sorry, I did not introduce myself. My name is Stephen Helfer. I am from Cambridge, Massachusetts. I belong to a group called Cambridge Citizens for Smokers' Rights. We accept no funding from any source whatsoever.
Thank you very much.
Thank you.
Okay.
Hello? Hi, can you hear me?
Yes, I wasn't going to take another person, but go ahead. You will be the last.
Okay, that's fine. Hi, my name is Jonathan. I am a member of the organization Stephen founded, Cambridge Citizens for Smokers' Rights. And just very briefly, I'm just concerned. I don't appreciate nicotine-free generation. You know, if I was a young adult these days and I knew in the future that I would not be able to purchase a pack of cigarettes, I'd be very upset. How would I definitely hold honest work? You know, a lot of people who hold honest work or honest studying really depend on nicotine products, ideally smoking, to pay attention, to take breaks, to stay focused, to look forward to. And I just, you know, I mean, I think it's completely unfair. If somebody's a grown-up, they should be able to choose to smoke. You know, they can join the Marines and carry a machine gun and drive a giant pickup truck and, you know, so on and so on, without being able to count on purchasing a pack of cigarettes or a cigar to enjoy after a day's work or for breaks during honest work. I just think that this is ridiculous, and it's just not a good idea at all. So, you know, when I was a young adult, I completely counted on smoking, and made me a productive citizen, and I really don't see any other way to look at it. So that's it. Thanks.
Thank you.
Thank you.
Okay. Is everyone all right with our calling it on the comments for now? I think we've-
Just one question.
Oh, yes. Yes, certainly.
So, again, can you just provide, when you have a board up meeting for tobacco and stuff, can you just guys email to the retailers?
I'm sorry. You're going to have to say that again for me.
So,
He
we
wants us
didn't know
to-
about this meeting until, somebody told us.
This meeting is our board's discussion.
Okay?
The way it works is that if we decide to go ahead and do a regulation, it
Okay.
has to have 2 public hearings.
Okay?
And at
So,
that time, that will be advertised in the paper. And, I'm certain.
as a retailer, right?
Yes.
Like we paying the fees for the tobaccos and all that, right? So you should email it
We'll have
to
the
us.
opportunity to come in and speak.
But how would we know that we have meetings?
It will be in the newspaper. It has to be posted, and
It's posted on our website and the town website also.
it'll be on the
So it
website.
would- So you
the
you
town.
guys don't send email to the retailers? Business,
Go ahead, Riley.
So you can sign up on the Town of Yarmouth website,
okay?
and I'd be happy to send you an email with some steps to help you do it, where you can sign up for notifications from the
Okay.
town.
Okay.
And all meetings that are put on the town calendar, we
Okay.
can do send message. So we send a message to anyone that's signed up for the town notification, so they'll be told when we have a meeting, and it'll be a few days before the meeting. It'll say Board of Health meeting,
Okay,
January 5th, and then the agenda is attached to the calendar as well.
okay, thank you.
Here you go. Thank you.
Thank you, Riley. Okay. So, I have a feeling next on the agenda is here it is. Is to review and approve the minutes for December 15th.
Are we going to decide how we want to proceed with this?
I think we're going to, I'd like to just go ahead and continue discussion on this next week.
Okay.
I guess right now I have more
Okay.
questions about Kratom than I do about the nicotine-free
Sure.
generation. Did you have,
Well, I thought, I understood your position on the Kratom. I'm fine with that. But
Right.
this NFG, I'm wondering if we can't just move forward with it.
I'd rather wait until Hillard's here too.
Fine, that's fine.
Okay, so the minutes for December 15th. Additions, corrections?
I
If
looked them
not,
over and they looked fine to me.
I have a motion for that, please.
I make a motion that we accept the Board of Health meeting minutes for December 15th.
Second?
All approve? Aye?
Aye.
Okay, so they are approved. Thank you. The Flax Pond Blood Drive is still January 23rd, still in the future. Also, the fall analysis on February 6th. Are there any spots left now? Yes, still some spots left. And I told Barry that I looked it up on the CDC. It's a CDC program from before, and it's very good. So I'm hoping if there are any people out there who have some concerns about falls or have fallen, that they will look into this. The number to call is 508-957-7423. Barry, new or old business?
We, over the holiday season, again, we had the Giving Tree. As for those of you that are watching online, these are all the presents that were donated to and from the town to local children in need. It was amazing. We literally filled up offices in the hallway, and those are 3 of our health trucks, SUVs that are full. Just taking them to the schools, it was a great, just watching the administration's eyes, just, they thought they were going to get a couple small things. That we were taking these large bags, and it took 6 of us time to take them in and give them out. It was a great project that Riley, Sarah, Deb all put together up front. They did a wonderful job. I want to give them a big round of hand for that. So,
Yeah, I think it's kudos to Sarah, Riley, and whoever was involved in that. That was wonderful. We all enjoyed participating in that.
Very nice.
I think these kids got a lot more than I did. So, but it's great. We will 100% do this again next year. So the Giving Tree, it was good. So. Handout from CBC, great day. What else? The health budgets are coming together. We have there's a town meeting tomorrow night. They're going to kind of briefly talk about it, but the next following town meeting, I'll be there, talk about the health budgets. We have put in the letter from Hillard. We are right on track for all of our budgets and our goals and everything like that, which is nice. The plastic reduction ban, the committee that we're on, that is absolutely 100% in full effect. It started January 1st, 4 days ago. If any of the establishments out there have questions, please feel free to call in, talk to the health department, ask the girls. They can ask the ladies up front. They transfer them back to me. I can answer questions. We've already gotten a lot of questions, not questions of why can't I do, why can't, of what are my options. And people are coming along and agreeing with it and following along. So it's nice. We're seeing it. I'm sure we're going to get calls saying, hey, such and such has this. But again, we're not making everybody just throw stuff away. We're giving everybody a time frame to work through their product and lower their inventory. So we want to keep businesses going from that. So that's good with that one.
I have a question. I know that Haley had asked if you were going to be researching products, and of course you're not. But as you find out, and the inspectors obviously, Phil, find out about products that are available, are they going to kind of jot it down so they can pass it on to the next person if they call and ask?
100%. I had one establishment stop in and said, show me something they found, which I hadn't seen before. It was a packet of to-go silverware that was in a cornstarch base container, and it had cornstarch base utensils and stuff. I hadn't seen those before, so they're bringing it to us. Say, hey, this is what we found, and I think, hey, if I have to buy this, And it's a little more expensive, but this is what everybody else should be getting to, so,
Just take a picture of it and put it in a loose leaf binder and
yeah.
have it available for people
And
to browse
there's, I have a feeling once it becomes more and more prevalent, there's the range of products out there that people will be asking for variances or waivers. It's going to be not as great as everybody says. It's kind of a, I've been in the hospitality industry all my life prior to coming to the health world, and everybody uses the same products, whether it's A, B, or C. So it's a narrow thing. We'll be able to get it down, and I think we're doing a great thing for the town as a again, Yarmouth is stepping up and being the leader in this initiative to help save the community and stuff. Whether it's nicotine, kratom, flavored tobacco, Yarmouth Health Board is always on top of it and a front forerunner for everybody. So I thank you guys for that.
So next meeting. We need one,
Yep.
Mid-month?
Next meeting is February 2nd.
no, it'd be the first and third is when we meet.
Well,
to-
there's a holiday at the next one,
Oh,
so
that's right. Okay.
so that's why.
It'll be February.
Yep.
February what, Larry?
I'm just following Riley's.
Oh, it's already up there.
schedule here, February 2nd.
February 2nd.
Groundhog
Did a great job on that.
We're going to talk about all this again.
Day. Happening and happening and happening, right?
Great, it's way ahead of us.
Oh, gosh, okay. I think I was doing okay until just then.
You did great. I mean, yeah, keeping us in order.
Yes.
You know, it's
Yeah,
been
right.
great.
Well, you're such a rowdy bunch, you know.
Oh,
It's
well,
really
we were
hard.
trying to do the right
Especially
thing,
Eric.
but
I mean, just kidding.
I was quiet tonight.
Okay, do I have a motion to adjourn?
So moved.
second.
All in favor? Aye.
Aye.
Thank you.